It's time for another GI focus on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Tina Nunziato, and with me is the beautiful Dr. Liz Cruz. Welcome to your show, Dr. Cruz.
Thank you.
Yes. So thank you for joining me today. Thank you for all of you that are watching, those of you that are new to us, those of you that have been watching us for years. We love you. Welcome. Today's GI focus is going to be on the topic of duodenitis.
What's that? I
want one. That sounds amazing. Anyway, Dr. Cruz is like, why duodenitis? I said, I don't know. Sometimes you throw words out to me and I'm like, I think we should do a podcast on that one. Let's do a GI focus. Whenever you come home and say, this patient had this or this patient had that. Anyway, you had a recent case and I just wanted to talk a little bit about duodenitis, what it is. So in typical GI focus fashion, Dr. Cruz, what is duodenitis?
Well, first of all, Tina, I just wanted to thank you for having me on your show.
Yes, you're welcome.
Yeah, it's such an honor to be able to be here. And so let's talk about duodenitis, one of my favorite topics. Duodenitis, simply put, is inflammation of the duodenum. The duodenum is the very first part of the small intestine. And just in case you didn't know, your small intestine, unless you've had some surgical resection of your small intestine, on average is about 22 feet long.
That's incredible.
It is incredible, yeah. And so when we do endoscopies, we go into the esophagus, stomach, and we go into the first part of the small intestine, and that's called the duodenum or the duodenum. And so duodenitis, itis, being the term for inflammation, is basically inflammation of the duodenum.
So what do you see exactly when you go in with the scope? Like, can you see it when you're in there? You're like, this person has duodenitis, or do you really only know after biopsies come back?
So that's such a great question. It can present in different ways, okay? You might just see some redness, irritation of the lining, the mucosa, which is the lining. You may see some redness. You may see what we call little erosions, which are like little abrasions of the lining. Or you can see ulcers, okay? So I always think an erosion as like an abrasion because it's kind of superficial. But if it keeps going and bores in deeper, you're going to ultimately have an ulcer sitting there. And I know most people are familiar with ulcers. You know, people talk about getting stomach ulcers. Well, you can get ulcers in the duodenum. So if I see inflammation in the way of seeing some redness or seeing some erosions or ulcers, then that's duodenitis, which is it's inflammation. Sometimes the lining may look normal. And the way that it's picked up is by the tissue. Like the lining may look normal, but I still take biopsies. You know, let's say that I want to rule out celiac disease. So I end up taking some biopsies in the duodenum on this person, and the pathologist might see some microscopic inflammation, and then they'll call that and they'll say, you know, these are the changes I'm seeing under the microscope. This is consistent with duodenitis.
Interesting. What are the symptoms that people typically present with when they end up being diagnosed with duodenitis?
So, great question.
Thank you.
So, sometimes it varies. I mean, I could find duodenitis on somebody who's not even having symptoms. Seriously. Like maybe I'm doing their case because they have anemia. Okay. And actually, I end up doing a lot of cases on patients who are sent to us because they have anemia, and the workup is doing an endoscopy with a colonoscopy.
And let me interrupt you there, because typically when you're going to see a GI, they're not doing an upper EGD, an upper endoscopy, unless you're having symptoms.
Right.
For the most part.
Exactly.
So typically somebody's going to go to a GI, they're typically getting a colonoscopy, but they're not necessarily always getting an upper endoscopy. But anemia is one of those diagnoses where an EGD or an upper endoscopy would be called for.
Exactly. And where that patient may not necessarily have symptoms.
Right.
Okay. They were just found to have anemia on their blood work. and now they've been sent over to GI for a workup. I might get into the duodenum and find some redness, some inflammation, some ulcer or erosion. And I always will ask them in the recovery room when they're awake, I'm like, hey, have you been having any pain? And a lot of times, sometimes they'll be like, no, I feel great. I was just sent to you because of anemia. So the spectrum could be anywhere from no symptoms to having abdominal pain, nausea, vomiting, especially if they have a lot of inflammation in there, feeling some burning sensation, bloating. Those are just a few of the different type of symptoms. It's not specific really, because it's not like, I don't know, it could be a combination of any of those. It could be all of those. It might be one or the other. It's not like I can say, oh yes, with all my patients with duodenitis, these are the symptoms they typically have.
Okay. And what do you find is typically the cause of duodenitis?
Great question.
Thank you.
So the most common causes of duodenitis would include infection with a bacteria called Helicobacter pylori. So H. pylori is short for that.
And we were diagnosing a lot of that.
Oh, absolutely.
In our
Absolutely.
office.
Yes. So that could be a cause. Also very common, in my opinion, probably the most common, just based on my over 20 years of doing this, are the use of NSAIDs, non-steroidal anti-inflammatory drugs that you find everywhere you go these days. Any store, gas station, it doesn't matter where you go, you will find Motrin, Advil, ibuprofen, Aleve.
They're being popped like candy.
They are. And what a lot of people don't know, and we've talked a lot about NSAIDs and what they can cause, but one of the things that they can cause is inflammation in the small intestine, erosions, ulcers, redness.
Can you talk a little bit more about that? Why is that? Why are these NSAIDs causing inflammation to the mucosa or the lining?
That is such a great question. So
I'm just full of them today.
You are. So look, this is actually a complex discussion, and I don't want to go there and make it
Too complicated.
So I'm going to make it real simplified.
Okay.
So basically, the NSAIDs, the anti-inflammatory meds, block the production of these chemicals called prostaglandins that are responsible for protecting the lining of the intestine. Okay, so basically these prostaglandins help in the formation of like a mucus layer that helps to protect. So these NSAIDs are disrupting like the shield that protects the lining.
Very
Does that make
interesting.
sense?
Yes.
Okay.
Very interesting.
Yeah. And so now, because those prostaglandins are blocked, and so you don't have that shield that the lining of the intestine needs, now anything is fair game as far as causing irritation, inflammation, ulcers. It could be even bile and acid that you're making. And of course, now you throw in the NSAIDs and aspirin. You disrupt that shield, and now you're just a setup for this inflammation, which, could be just anything from just redness to, actually can be anything from microscopic inflammation where you don't visually see something when you're looking with a camera, to redness, to ulcerations. And I want to just say, and I've had cases like this where the person has been taking so many NSAIDs for so long that they have been forming ulcers for years, on and off. And over time, because of the inflammation and then the healing, which forms scar tissue, they end up developing these narrow areas, strictures, in the small intestine.
Wow.
It's like a narrowing that can cause a blockage. So it actually is serious, because somebody could present with a blockage there in the duodenum, where it's not, necessarily from a tumor or a mass or cancer, but just from scar tissue that's developed from chronic inflammation from possibly taking NSAIDs regularly, daily, for years and years.
Wow. Okay, so you've got H. pylori, you've got NSAIDs. What else?
Celiac disease.
Okay.
Celiac disease, which is where the villi, which are these little microscopic finger-like projections that line the entire small intestine. That's where the absorption of nutrients takes place. And those little villi can become blunted from gluten, okay, that is present in so many things that we eat. They develop a certain type of inflammation in that area, duodenitis. But usually on those biopsy results, the pathologist will go into depth about actually describing the villi and how they're blunted, meaning they're shorter than they should be, or maybe there are no villi. Also, certain inflammatory response with certain white blood cells that are in the tissue there that are coming in as a reaction to the inflammation, to the injury from the gluten. Does that make sense?
Yes.
Okay.
So you can have it from H. pylori and the villi look normal, but if it's from celiac, the villi will be blunted.
Right.
Okay.
Right.
Okay.
Yeah. So I would say those are some of the common things. But I have to say, by far, I mean, I've been doing this for over 20 years, thousands of endoscopies. And I have to say, by far, I would say NSAIDs and H. pylori at the top.
Yes.
H. pylori. I mean, very, very common. And, people take these things even to sleep, which I'm like, okay, NSAIDs are not supposed to make you sleep, but they're out there.
It's the PMs, right? The Advil PM.
Yeah, yeah.
It's, so eliminate pain, and it has medicine to help you sleep.
Exactly.
It's, killing two birds with one stone and killing your intestine.
Exactly.
Apparently. Yes. So before we move into the treatment for this diagnosis, we wanted to do our commercial, which you picked the gastrogreens for this one. So talk to me a little bit about why you picked the gastrogreens to talk about as the commercial for this podcast.
I just felt that the gastrogreens are so important because it's basically a ton of greens that have been dried and pulverized into powder, and it's just a richness of all sorts of vitamins and nutrients, and we need that to heal our body. So if you're having any sort of inflammation in your body, any itis, whether it's, I know we're talking about duodenitis on this podcast, but whether it's any type of itis, even just like arthritis, whatever kind of itis, you need the greens because the greens is what helps your body heal and keep you healthy. And by the way, also, I highly, highly recommend this in place of vitamins that you may be taking, especially those hard tablets, vitamins. I mean, you've probably heard me say this on previous episodes. I find those all the time in the colon, and they're intact. So they haven't even dissolved. So you're not even getting the benefit of it, not to mention you're wasting your money. I'd rather you buy a bottle of our Gastro Greens and take that because that's what's going to help to heal you, and it's going to take the place of your vitamin.
Perfect. All right, so let's move on to the treatments for this. When you do diagnose duodenitis, what are the treatments that a person has to go through once they're diagnosed?
So the more common causes are the NSAIDs, aspirin, and H. pylori. So if they end up having the H. pylori infection, then we give them a treatment for 14 days. And
antibiotics.
Yes, that's antibiotics, along with a proton pump inhibitor, which is like the Prilosec type medicines, Nexium, pantoprazole, Prilosec, omeprazole. So that is part of the antibiotic regimen that we use in treating patients with H. pylori duodenitis. If they are on an NSAID, I advise them to stop it. They have to stop it. You could argue and say, well, you can stop it for a couple weeks, things should heal up, we'll put you on a proton pump inhibitor, a PPI like Prilosec, omeprazole, and it should heal it up. The issue is that once you've had ulcerations, you are at risk for developing more ulcers in the future. So my philosophy is, if your biopsies are negative for H. pylori, we know it's not an infection, we know it's not celiac disease, and you have a history of taking NSAIDs regularly, you've got to stop the NSAIDs. And I've had patients who have been concerned and upset because they're taking it maybe for migraines or maybe for bad arthritic pain, arthritis, they have bad pain in the back or wherever the joints are. And I'm like, you have to go talk to your primary care doc and figure out something different. But those NSAIDs, if you continue taking them, are going to eventually burr a hole through your intestine, where then you can get a perforation and become very sick. And you don't want to get to that point. Or, like I was talking earlier, if you continue to take them and you develop these ulcers over time, you could eventually develop narrowing, like an obstruction in that area, just from chronic inflammation and the healing of scar tissue. And it's just like a vicious cycle.
What is the treatment for celiac?
For celiac would be a gluten-free diet.
So you don't have to be on medicine.
No. Typically a gluten-free diet. If that person's been on a gluten-free diet and let's say their celiac labs are still not improving and they're not feeling well, they may require some more aggressive treatment. But in general, the gold standard treatment for diagnosis of celiac disease is a gluten-free diet.
Okay. And then as far as a more holistic approach to duodenitis, typically if you've got an itis, that means you need some form of traditional treatment.
Right.
It is tough to treat it just purely holistically. There are some naturopaths that I've heard that have tried to treat H. pylori more naturally, but a lot of times they end up giving antibiotics still.
Right.
So are there, aside from needing to be on antibiotics in some of these cases, what would you say is a more holistic approach to treating duodenitis, even long term?
Sure. Yeah, so...
Aside from coming off of NSAIDs, coming off of wheat, obviously
Yes.
those would be the things. What else?
Yeah, so I would say that the greens that we talked about in our commercial are very important, because the greens are nutrients that your body needs so that your cells will be healthier and so that you can heal faster. So definitely the greens. Also, we have a product called Delicate Detox, which maybe you've seen our video on that. We do have a special going on now for the next month, where if you buy one bottle of the detox, we will send you 2 free bottles, okay? 2 free bottles for the price of one. So you'll get 3 bottles.
We got to get these in people's hands.
We do.
We got to get them.
That's right. This is going to help detox your body, loosen up those toxins wherever they are stuck in your body, and get them out, flush them out in a gentle way. It's not where you're going to be stuck on the toilet all day long. So the detox is really important. And I'm telling you, this is a smoking deal. It takes about 90 days before you actually start to see the impact of detoxing. You want to take it on a long-term basis. And actually, even after 90 days, we recommend that you continue taking it, because your body is exposed to how many toxins?
200,000 plus.
200,000 plus.
Regularly.
Okay? You should be on the detox. So the detox and the greens.
Yeah.
Drink a lot of water. Yeah. Keep your body nicely flushed, and that should do the trick.
All right. Anything else, Dr. Cruz, that you want to talk about with regard to duodenitis that we did not talk about?
No, I think that we covered it. I mean, look, we did a very high level of duodenitis, covering a few of the common things. There's other things that we didn't discuss. There's even certain parasite infections. I wanted to focus on what are the common things that we see and give you that information so that you could be aware of it. And also, in case you didn't know about the issue with NSAIDs. It's so important, especially because these are everywhere and people just buy them and take them like candy. Yeah. And these, yes, they have a purpose. However, what a lot of people don't understand is that they also can have a lot of
long-term
side effects that could be serious.
Yeah.
So, anyways.
Very good. Well, thank you so much. Thank you all for joining us. If you want to connect with us, please go to our website. We offer a free 30-minute wellness consult. If you click the magenta colored button on the home page, you can schedule a time that works best for you. If you haven't already rated us, please rate us. Please give the show a 5 so that other people just like you can find us. And please, if you have not subscribed, subscribe to this show, subscribe to our newsletter. There's a lot of things we love to teach. All of this information is free. We want to keep teaching you for free. So jump on that newsletter so that we can educate and do what we love.
Yes.
Help you as much as possible. So thanks so much for joining us again, and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.